And thank you to our three speakers for very insightful and stimulating presentations. We've had tons of questions, so I hope we're going to be able to get to all of them before we finish up at about 12:35. But before I do that, we're in addition to our speakers, from you've heard from already, we're going to be joined by two further contributors, Professor Dermot O'Donovan and Dr. Orna Young. So just to make the introductions, Dermot is the Director of National Health Improvement at the HSE and has a new public team here focused on addressing health inequalities and developing partnerships to support a health in all policies approach. And Dermot trained in general practice in public health, but has also worked in several countries in Africa. So I'm sure Dermot will have lots to add to the discussion. And Orna is the co-founder and managing director of Fact Check NI. Orna holds a PhD in politics from Queen's University and is a board member of Northern Ireland Open Government Network and a member of the Ofcom Evaluation Working Group. And just for those of you who are not familiar with the organisation, Fact Check NI grew from research that found that social media was having a profound effect on the nature of community relations in Northern Ireland. So welcome to Orna and to Dermot. There are lots and lots of questions, which we've got some of them. We continue to put them in the Q&A function, but I'd like to start off by asking the panelists some of the questions that may capture some of the key themes that were discussed today. So I might open with Anna. Anna, if that's okay. I mean, really, you've been talking a lot about the systemic problems and the political and scientific practices, I think, used by industry, what we would know as the playbook approach. You know, this is the potential of creating an awful lot of damage. And how do we protect science and evidence? We talk a lot about evidence when we talk about moving policy and legislation in this area, but how do we make sure that the accurate evidence is presented amongst all the noise that is generated?
In a way, there's two elements of that. Let me talk about protecting, how science is done really and published, rather than the misinformation side, which is more Peter's area. So one of the concerns is, we have shown that diverse industries influence science in their own interests. We also know, if you look at OECD country data, that private sector funding of science is going up and public sector funding is stagnating. So the potential for poor science is going to increase. And yet we're in this situation where, for example, we've got industries producing new products. Let's look at the tobacco industries producing these new heated tobacco products. We know that the industry science on those products is very poor quality. So we would all be way better off, ultimately, if that science happened, if industry paid for that science but didn't have control over that science. Because why should we as the public really fund that science when it is going to go to industry profits? And it's a different model for funding science. So to me, that's the ultimate solution, that you have a situation where you would tax these corporations, put that funding in a pot that then is administered totally independently to ensure that science functions in the public interest. It's hard to do because we've got such a long established system of corporate influence and corporate links into government and so on. There are some models. So California has a system of taxing tobacco companies, and then there's that money is used to fund totally independent science that is well protected. Thailand actually has a model where it taxes tobacco and alcohol industries to fund science and advocacy, because remember, we do also need advocacy. And historically, at least Italy had a similar system for pharmaceuticals. So these models are possible. There is also work showing that the criteria you need to meet to ensure those models are safe. And we have to be very careful. We do set up those models that the industry influence doesn't continue. So to me, that is the ultimate solution that we need to be working towards. In the shorter term, I think we need to do a few things. We need to make sure that research people and those within research institutions that are administering funding are trained up on industry practices and conflicts of interest, because you've got to ensure, for example, that grants have freedom to publish. We've seen the contracts that industry draws up, often with them having control over the data. So there's training. We've trialed a training recently, and we've published that needs to be rolled out. We've got to improve our reporting of conflicts of interest, and here I think what would be far better would be to have a single online database of conflicts of interest of authors and editors, because every time we submit to a journal, I'm sure the academics say, it's tedious, you're filling in all these forms anywhere for medical journals about conflicts of interest. Other journals don't even have that requirement. And yet we know that people don't accurately report their conflicts of interest. So if we had a single online database, again, that was independently administered, A, we wouldn't have the faff every time, but B, that information would be available to the public. And we need it on editors too, because we know that industry historically has put editors in place to edit journals, and we know there are journals that do have those links. So I think those are some of the key things that we need to be moving towards, the training and database in the shorter term, and I think the funding model in the longer term.
I think that's really interesting, Anna, because I think that whole issue of conflicts of interest has an impact for people working in health promotion, and maybe Diarmuid could speak to that a little bit later on in the conversation. But I think also in terms of the media narrative, that conflicts of interest are not always recognised in the type of material and evidence and narrative that gets onto the media. So we might come back to Orna and Peter on that a little bit later on. Could I just ask you, just before we move on to Norah, the issue of the FCTC Article 5.3, which you mentioned in your presentation, obviously this has been very successful to a degree, and often other areas, and this has come up with some of the questions, that should we be looking at a similar measure for alcohol, with regard to alcohol policy, but also regard to ultra-processed food. Have you any thoughts on that?
Yes, we should. I mean, basically, I think the best way to think of Article 5.3 is it's a conflicts of interest or a good governance policy. And let me just be clear, industry uses the term good governance, and when it's using it, that does not mean good governance. So I mean genuinely good governance. And to my mind, it would be far better if we move towards a position where governments understood that this isn't a conflict between the product and health. Of course, tobacco is harmful, but it's a conflict between those corporations' primary financial interests and health. And if you have that simpler understanding, and across the board government moves to implement that, then it will be far easier to implement. So the problem we have with 5.3 is that ministries of health understand it and they get it, and most work really hard to implement that. But then the industry goes through the back door to the Treasury, the Finance Ministry, Agriculture, so on and so forth, depending what country you're in. And they don't necessarily get it. So I think we need this generic understanding that corporations are not there to act in the public interest. It's government's job to act in the public interest, and corporations are acting in their own financial interest, and very often therefore they're conflicted. And I mean, we've written a piece on this recently, which I could send you to send out. But I think we need to move towards this simpler understanding of conflicts of interest that goes across all government departments. But a simple way to think of it is an Article 5.3 across these areas. But we need to make sure that there's a danger that is perceived as product versus health rather than corporate interest versus health. Does that make sense?
Yes, it does. And I think it's a very interesting nuance there that, I think this particular discussion needs to be nuanced if we're going to make progress on it. So that type of teasing that has been very helpful, Anna. Just moving on to Norah. Norah, you're obviously coming from a business school background, and I recently listened to the excellent Nathan Mani podcast, Money, Health, Power, where you spoke in detail about the role of business schools and the role of business more generally. Now, in general, business is a very positive thing, but where people are creating good jobs, good employment. There are a small number of companies who are acting against the interests of public health. Could you talk a little bit more about how you think business schools are shaping the health agenda?
So I think maybe I would be a lot more forgiving than Anna about businesses and people who work in businesses, because I think there's less engagement really when I think about so many people I know who work in these industries, that they're engaged in health washing and lean washing and green washing, etc. And we call it health wishing and lean wishing and green wishing. So the individuals who are working in these companies hope that their efforts of food reformulation or community, exercise programs, etc., are not to slingshot to balance up the problem of the problem causer and the problem solver. And I think coming at it from that perspective leads us to understand that from a systems perspective, what we have to do is maybe focus really diligently and laser-like on the incentives and the disincentives in order to provoke industries and companies into taking particular actions. Certainly from, we graduate hundreds of students here in this business school and business schools all over the world. 1 in 3 degrees across the world are from business schools. So we have an obligation to those students to train them and to educate them in the idea that there are biophysical limits to what we can do, and there's a social foundation to what we have to do. I think when you talk to people working in these fields, including quite senior people, they're very conflicted themselves. They know exactly what Anna is talking about. Research from Safe Food Ireland, which is about to be released in November, so it's under embargo at the moment, but I hope they don't mind my saying this part of it. They did really interesting perspective on looking at digital advertising of junk food to children in Ireland. And one of the interesting aspects about that research, Suzanne, was they interviewed digital marketers. And they said, what do you think of this? What do you think you are doing in this field? And nearly universally, all of them said, we want better guardrails around this. So ridiculous grey area all the time where we are, because of the incentives of the organisation, pushed into making these decisions that we know are very, very conflicted. So I think that that's our obligation to call out that I don't even think people who are graduating from business schools want this to happen. And maybe if I can say very quickly, because I can see it in the Q&A, and I want to mention this idea from Grant Ennis and Maeve Van Skulkwyk, both people working in the commercial determinants of health, that they call the hypocrite's trap. And the hypocrite's trap is this idea that I have to, not smoke and not drink and not eat bad food in order to make any pronouncements about the commercial determinants and vectors of disease. And that, I think, is happening all the time in this country of going, I am not doing enough, and no one is doing enough, and everyone is failing. So we just have to feel better at it. And one of the things is we have to forgive ourselves of saying, stores full of junk food, but that does not stop me talking about the commercial vectors of disease, and we need to be really clear about that. That's our role in the collective, and our role as individuals is at the downstream end of things, not this upstream, which is all of our professional roles.
I think that's really interesting, and I think it also plays into the personal responsibility narrative, and there's almost a chilling effect on people. Unless I'm living a monk-like existence in perfect health, I'm not able to comment on this. And I think that's actually one of the things that's quite subtle and insidious, and does kind of inhibit some discussion around CDOH and the wider issues. But I think just moving on then to Peter, I think, Peter, one of the questions I had to you is, have you got an example of very damaging health misinformation? And of course, the HIV, the beetroot kind of example you gave in your presentation, I thought was, really very stark. One of the challenges, I think, for people working in this area is engagement with the media and the whole issue of false equivalence. And for those of you who are not familiar with that term, it's really where you've got what tends to happen, and it's particularly happens in Ireland as a result of the McKenna judgment, where broadcasters are absolutely compelled to have balance in arguments. So what can sometimes happen is you have a speaker with whom sort of the scientific consensus is on one side of the debate, and then there needs to be found someone else to counter that. And I think the actual challenge there is not so much that system, it's the fact that people have a lot of faith still that people who are on media are in some way verified or fact-checked or accurate. And I think that can often distort the debate. I know as a journalist, I'm sure you came up against that all the time. Do you have any thoughts on how we might mitigate that?
Yeah, so I guess the false equivalence, one of the terms that I see a lot is the problem of both sidesism. And so that you will have false information spread. I mean, the thing that most people think about currently is still in relation to COVID. And so you will see this as being present, the effects of COVID and all the different debates around the best ways of treatment and so on. This is very often treated as if it's a political debate where reasonable people have different points of view, when, right, they might have their reasonable different political points of view, but this is the scientific consensus is fundamentally here, and there are other people who have an opinion, and yes, and so there is a lot of pressure, and that goes back to, so there can be rulings from media regulators, there can be the way that journalism schools teach us to work. I was taught that you present, you go and talk to both sides of an issue, because there's always two sides, there's never more than two, but you go and talk to both sides of an issue, and then you present their view from one side and you present the view of the other. And when I started, when I started Africa Check, I was working at the AFP news agency. So it's a Paris-based news agency, equivalent of Reuters or the AP or what have you. And there was a lot of debate, and they now do a lot of very good fact-checking work, a lot around the world. But when we started Africa Check, there was a huge debate saying, well, hold on, it's not our job. It's not our job to say this is true or this is not true. It's our job to say this person said this and that person said that. And you present it. And so we will expose the sort of foolish claims of this side of an issue by saying what they say. And I think there's a fundamental failing in journalism that does that. The ways to deal with that, yes, it's that regulators need to understand that that false equivalence is a problem. Journalism schools need to understand it, and senior editors in media need to understand it too.
Thank you. And just a very brief follow-up question before I go to Diarmuid and Orna is that there are media guidelines presented in certain topics. I mean, around suicide and self-harm would be one, and other issues. Do you think, it's hard to know whether journalists find that helpful or they find it intrusive. Obviously, there's been a lot of work done in Ireland, particularly around how you speak about mental health in the media. Do you think those sort of things for public health would be useful?
I think they'd be tremendously helpful. I mean, so I know, so I think my partner worked at the Samaritans, as I think you know, and led work on media, the media guidelines and the discussion with media organizations. And having been an editor in a media organization myself, I found, I mean, so long as the guidelines were sensibly constructed, which they were in that case, I found them tremendously useful to me as a journalist, because helping me step through a complex issue of how I report a major news event of somebody who's famous has done this thing in a way that is not going to cause harm. I find it tremendously helpful. And I think, in a way, as Norah was saying, I think most journalists, maybe this is my naive thing, but I think most journalists are not seeking deliberately to do harm. And if you can present, particularly around an issue of public health, that look, the way you're presenting this is going to cause public health harm, I think most journalists in many traditional news organizations will welcome those guidelines.
Okay, it's a very interesting view. Thank you, Peter. And it might be something to do to sort of balance out some of the challenges around lobbying and misinformation. But I'm going to move on now to Diarmuid. So Diarmuid, you're very welcome. We spoke earlier in the discussion about the whole area of corporate social responsibility, that's come up. And one of the issues I know is that particularly in the area of health and well-being, which is within your remit is that there are a lot of perhaps non-health organisations who seek to engage with health organisations, either directly with the HSE or with NGOs or charities who are delivering work for the HSE. That can provide a challenge in itself. Is that something you've been thinking about, or, and I think also that sort of the HSE, as we know in Ireland, is still regarded as a very trusted source of health information. So how do they hold on to that particular status where they're still seen as, despite all the trust issues we have around the country, I think that they're still seen as, for health information, a reliable source?
Well, there are guidelines being developed with the University of Stirling and the Institute for the HSE about engagement with industry and with potentially health harming industries, so that people will be able to check and figure out if they're doing things that could be causing harm or legitimizing potentially harmful things that are happening. And that will come soon, and we need to socialize that into the system as widely as possible and get people to think and question. And I think Anna said about advocacy, that everybody working in the health system is an advocate in some way, and we need to remember that, and that we should be able to question and look for where there are problems. I'm struck that we talked about this as being about the political determinants, and I teach medical and public health and health promotion students, and the first day I always quote this Virchow, this 19th century German physician and politician, who said that medicine and/or health is politics, and politics is health at larger scale. And we have to remember that. And politics is all about decisions and about power and the things that drive the social and commercial determinants of health, and that we all can influence that in different ways. I see some of the comments in the chat are kind of a bit despair, but I mean, I think meetings like this are about changing the culture and changing the ways we think, and we really do need to see that there are ways to change things, and that there is a lot of good things happening around making differences around this. Like the awareness of all of this whole area has just mushroomed in the last few years, and we just need to spread that more as well.
I mean, I think I'll come back to that point a little bit later on, but just to bring Orna into the conversation, thank you, Diarmuid. Orna, in your sort of work, you're focused on fact checking. Where does health information sit in your work? Orna, I think you may be on mute. Are you? Can everybody else hear Orna?
Can you hear me okay?
Yes, now we hear you.
Sorry, apologies. I'd like to say it's probably pretty central to what we do. I'd like, in our work, I suppose, when we're dealing with kind of social issues and the onset of COVID, which was, just came out of left field for us, that they are separate, but they're not. The same issues kind of are like a Venn diagram of the type of approach that bad information kind of manifests itself as online, so it has become exceptionally central, but we see the same type of maneuvers at play with it in terms of how it's manifesting itself, how it's being met, the impact it's having. Peter spoke about this at length, so I'm not going to go too much into that. But what I suppose, fact checking Northern Ireland, and we explicitly focus on it as a region. We don't fact check the South, but with something like a health issue as COVID, as vaccines, as what's being discussed today, which, by the way, folks, if there was ever to be a Netflix special, I think the three panelists would make a really good one. It's such an interesting interplay of issues at stake here, folks. But what it kind of exacerbates for us in terms of this is the need for coordination on an all-Ireland basis, and the importance of that. When we went to fact check, and I hate to kind of emphasize it as a health event, but COVID in the last 5 years, when we went to fact check it, because there was different means and manners and ways in which health evidence and data was being collated and collected in the South in comparison to the North, and vice versa, not to draw judgment on which was better, they're different. So it was really challenging for us who lived, I'm from originally from County Louth, you know, you skip over the border and the headlines were different. The nature of the type of information that was being shared was different. And we're also dealing with that, you know, I'm so pleased to hear that kind of issue of false equivalence being brought up, because it is enormous for us up here. I'm frequently invited on to, you know, debate people on issues such as health or, you know, social issues that are emerging, and poverty, equality, things like that. And we very much are of the belief that, you know, someone's opinion isn't of the same value in terms of one of our comprehensively and expertly kind of put together fact checks. So it is a real problem. In terms of, I'm conscious of the negativity that people feel about misinformation and the powerlessness they feel in relation to it. But I think there are real opportunities here, folks, you know, in terms of the types of information people are getting and who's accessing it. You know, we've been able to scale our work in a way that, you know, because of better technology, how we're communicating with people is constantly evolving. We have to adapt as fact checkers. We would kind of sit, well, our organisation does anyway, outside, say, journalism a little bit, because our background is research, like we're all research by trade. So I think working across sectors, there's so much of our work and the work of the private, public sectors we need to coordinate better on this stuff. And we did it during COVID, folks. We worked with the Community and Development Health Network in the North to kind of message, you know, good information, because we are a trusted source. And I think that's really important. I know Norah mentioned earlier things like journalism, and we're very cognizant of that there is a cycle of people kind of, I suppose they work to scale in a scale that we couldn't imagine, folks, to be honest, in relation to the local media here. And we are very cognizant of that, to be slightly sit apart a little bit, I suppose, in terms of fact checking work. So I think all these things are so multi-leveled, and I don't use that term flippantly, I mean it genuinely, in that we also have to be cognizant of the messaging from the top down in terms of our political and those in positions of power, and how they're messaging, as well as the community and voluntary sector and the private sector. So I think it's something for us all to reflect on, and not to kind of hammer out Peter's points so much. Peter's been very good to fact check and I over the years in terms of almost like an uncle or a big brother figure in terms of good practice of fact checking. But I think all this stuff does is show I suppose the importance of an awareness of the types of information we're accessing, and also the actors that play in the background, which Anne, I think, did a really great job. It's just so interesting to listen to all this, of talking about, you know, who's influencing the narratives here, who's influencing the discourse we're dealing with. Because the problem we have as fact checkers is people not trusting anything, folks. That apathy has really crept in, and we are witnessing to that on our work and in society at large here in the North.
That's really interesting. Thank you, Orna. And a couple of questions have come in now relevant to what you and Peter have just been speaking about. So I'm going to take them straight away. But I think one of the things I think that is important for us on a practical level, for those of us working in public health more broadly, is one of the things that Peter said earlier in the space of information, is that it's not enough to say something once. And I think sometimes that's one of the challenges for the scientific community, is that, you know, the evidence is there, and this has come up in questions as well, you know, is the evidence not enough? Well, I suppose the answer to that is no, the evidence isn't enough. You know, there are lots of different things that you need to do in order to make the evidence turn into impact. And, you know, I think communication is one of those things. And something that we often discuss is that budgets for communication around health are very limited. They tend to be focused on short-lived campaigns, informational campaigns, and that's it. And then we move on and we sort of feel we have done that. But in actual fact, you know, it's a hobby horse of mine, but I think it is important to sustain a public health narrative, where there is a sustained narrative about public health topics that can build trust with the public. And the HSE have been successful in some aspects on that. And, you know, it's important to recognise that. But I think it's, you know, that is becoming more and more important, you know. But if I could briefly go back to Peter and Orna, two questions that have just come in, which we'll take together. The first one is, to what extent is AI contributing to the availability and impact of misinformation? And the other one is the government coming down on misinformation enough, or do they need to do more? And just to let you know, there is a big a report due to be published soon from the government's online health task force in Ireland, which will look at some aspects of that. But do you have any comments on either of those questions?
Okay, I mean, I'll if I go.
Yeah, sorry, feel free to jump in. Yes.
Okay, so very quickly, AI makes it a lot faster. So in terms of the quantity of misinformation, disinformation in the case of AI, it's a lot easier to produce. Whether it has more impact, we don't know. Is the short answer. But I'll come back to you on that. In that, I'm doing a study with colleagues at Full Fact, which is the UK London-based fact-checking organisation, and that's for the UK AI Security Institute, looking at, is AI-generated misinformation, is it in itself more harmful than human-produced disinformation? So naturally produced disinformation. So we don't know. We're doing a study. What we do know is it's a lot easier to produce and quicker to produce. First point. Second point, are governments coming down hard enough? Around the world, one of the problems is so a lot of governments are using the opportunity of concern about disinformation to crack down on speech they don't like, and very often on accurate speech, and so that's a problem. I think that regulation models have to be based on identifying the harm, and when you can demonstrate that the false information or hate speech is leading to real world harms, people accept that as being legitimate and the right thing, not just legitimate, but the right thing to do. It's where you appear to be, where the regulation appears to be focused on opinions and controlling speech and so on. So the way that, so first of all, it has to focus on what is harmful, and secondly, that very often the way you come down on it, as it were, is you present counter information. It's not simply because if you ban or force the removal of information in one public space, so you force its removal from Facebook or what have you, it then pops up on another platform that is harder to control. And so the WHO argued during COVID, don't take it down, argue against it. For that reason, look, otherwise it spreads in places we can't see. It's a bit like the sort of counter drugs policies and so on. We have to counter it. We have to counter it effectively. And with so much of it, we have to focus on what's harmful. But
can I just come in there, Suzanne,
yes,
as well?
of course, yeah.
I think it's really interesting at the moment to watch kind of a move away from human-led. In our work fact-checking, you know, we have platforms who admittedly aren't very transparent in how they are trying to mitigate bad information on them. You know, we as fact checkers, you know, have worked, you know, many of us work in terms of organizations with platforms on this, but there are cases where and I look towards, say, X or Twitter, where, you know, it's Grok now, it's you know, AI led. And what's really interesting to us and kind of humorous almost to watch is that people are asking Grok to fact check us, and Grok is surfacing our content in response. So there is always the space for human beings in fact checking and oversight. And I think that when we relinquish or indeed surrender in some sense to complete technological I suppose attempts to mitigate the stuff, then I think that is currently problematic. But I think there's a lack of transparency. I kind of talk about all the time that transparency and accessibility of information is just so important to show people how you're getting to a certain conclusion. And I think that's really missing at the moment from a lot of the efforts, or what they're asserting are efforts to mitigate bad information. And in terms of government crackdown, you know, I think we're very fortunate in the European Union, or those of us who are still under the influence of it, that we kind of have oversight to that end, and that there are coordinated efforts on that. But I would say that by country, by region, you know, what goes on for Full Fact in the UK or GB, sorry, compared to what goes on in Northern Ireland, what compares to what goes on south of the border, can sometimes be very different. So I think it's kind of taking it on a case by case basis and understanding the kind of social and cultural context of that specific space and how people will react to that. To my mind, that kind of crackdown may work some spaces, but it wouldn't in others. And it goes back to that issue I was talking about earlier in terms of trust and building those relationships with the audience that you're trying to, I suppose, communicate with?
Thank you both. I mean, I think it's really important that sometimes these aspects, the commercial determinants of health is a difficult conversation to have. As the Minister has spoken, these can be complex conversations, but I think the whole area of communication and misinformation is often seen as outside of public health, but actually I think it's a really important part of it. So thank you both for your insights there. I'm going to move briefly to some questions. We've had a lot of questions from the audience. So some of them are Ireland specific. So I'm going to start with the first one, which is, and this is referring to the Lobbying Act in Ireland. So for those, just to make people aware that there is a lobbying register in Ireland, has been, I think, since about 2013, 2014, where people who are lobbying to change any type of government policy must go on a register. The Department of Health in Ireland is the most lobbied department in across government. So the question is that how, with the current iteration of the Lobbying Act, is it fit for purpose, or does it need to be updated to address kind of more sophisticated lobbying approaches now? So I'll throw that open to everybody. I appreciate not some of our non-Ireland based speakers may not be totally familiar with it, but maybe Norah and Diarmuid, you might have a thought on that.
I'll jump in very quickly, and maybe Diarmuid, you follow up. So the lobbying register is a great step towards transparency, but it is one step in 100 things that have to be done. So this is the problem all the time. We get to step one, we say, right, we're finished now. So there's absolutely zero consequence to any of it. Very few researchers use the lobbying register. Very few journalists use the lobbying register, and even when those results come out in newspapers or peer-reviewed publications, nothing changes. So Anna talked about, in a system, all of these market and non-market actors react to intervention. So that's the ballooning effect. There's a kind of counter reaction by an industry. So this is anecdotal, of course, but when the lobbying register was enacted, the first thing I heard managers say was, well, we are obviously putting nothing on email anymore, and we're not taking notes. And it was just a whole new cottage industry of how you would take meeting minutes. So when I look at the lobbying register and I get, the meeting minutes that Coca-Cola has had with the Minister of Social Protection around Brexit, I was expecting to see loads of redaction, and, this would show, oh my goodness, look at the nefarious activity. And of course, redaction doesn't happen either. What you get is this blandicization of the interaction. So yes, fine, but it doesn't. It's really. Yes, it's a hygiene issue in that we have to do it. Let's not congratulate ourselves on it, and let's focus now so laser pointedly on what are we going to do about monitoring and the consequences of infractions.
I think that's very interesting, Dermot. I'll come to you in a moment. I think the key, I think you've identified something that happens there. And I mean, that's just a function of government. Policymakers are so busy. There's so many things on the agenda. We've got the lobbying register. It was a very positive thing. Lobbying is part of the democratic process. We're done now. And we just don't look at it again for years and years. And we're working in very dynamic, fast-moving spaces. So I think it's certainly something that could be looked again, certainly from a health point of view, and the amount of work that Department of Health officials have to go through in terms of how heavily lobbied they actually are. Dermot, did you want to add something on that?
While it's great to have it and some changes needed for sure, it's really hard to get a sense of all the informal lobbying, like what happens outside the room, all the other opportunities that people have to meet and discuss. And that's really hard to track and try and see how, where those influences come. So that's a bigger challenge, I guess.
And I think there is also, the other thing to consider is the positive side of lobbying is to galvanise everyone working in public health to act as informal or formal lobbyists. I think that sometimes people can be reticent about, and a little bit of it goes back to the fact that I have to be the perfect public health person before I can express opinion on anything. So it's the mobilisation of people who are interested in public health objectives. I think, we can often learn from commercial actors as to how they approach things. So another question that came in somewhat in a similar space is in a crowded, legislative environment, how can we kind of get cut through for public health legislation? because public health legislation, like much legislation, particularly public, is often very contested, very controversial, it can take an incredibly long time, as anybody who's worked on it will know. Is there any way that is there any technique that we could to sort of seek to prioritise it on politicians' agendas? I suppose really the question there is, can we shake the nanny state finger-wagging view of public health in how we present these measures, which inevitably always improve people's lives and are, you know, generally supported by the public? Norah.
I think Anna will probably say a lot more here, but as I've written in the comments, the vital thing I think we have to do, and certainly Anna has said this, Sandra Galeo has said this, Nathan Manny has said this, so it's not new, but health is not the end point. And I think we are so fixated in saying we are going to be guardians of health. And actually health is just this thing that we mostly know that if you have a healthy body and a healthy mind, it gets you nearer to being a human, and it gets you nearer to pleasure, and it gets you nearer to the things that are really great, like being lazy or being rebellious or having just a full social life, everything. And this is the key. And so we kind of tend to think of it as the end point, whereas the industries that we've been talking about claim and co-opt all of these things like sensuousness and pleasure and the sheer amazingness of being human. And that's what we need to do. We need to say, no, we are the guardians of this, and we will unlock that for you. And we need to do a two-handed structure of kind of emphasizing that much more and exposing the ridiculous classical conditioning that has happened across these industries for decades that associate, you know, fast food with luxury. And rebellion and elegance and, you know, promiscuity and all of these things that people actually genuinely want in their lives. And we need to stand allied to that and saying health is going to give you that.
I think that's a brilliant point, Norah, and a true marketeer's point. So, and I think it's a very positive point as well. And we've noted in some of the questions coming in, there is a slight level of despair at the size of the task ahead of us. And I think it's really important that we don't have that. So I'm going to ask you to finish maybe on a positive note, maybe to highlight sort of certainly significant progress has been made, but maybe on a positive note about progress in this field and where, you know, something that, you know, people can take away to perhaps do in their own phase of work, be it at local level or national level. And I'll start with you and go in sequence as before.
I mean, building on what Norah just said, health is also essential. We have nothing, we have no economy unless we have people to work. You know, health is absolutely a prerequisite for everything. The other thing is public opinion is on our side. The public get this. They know they're being manipulated. They know that government isn't taking action. So we need to harness that public opinion, whether it's just simply in public opinion surveys or bringing them on board. I think the other complexity is, you know, the issue with the climate crisis, the commercial determinants of health it is the climate crisis. It's all of these things. And in a way that can feel overwhelming because, you know, then we need to reach out to these other sectors. But I think we can straightforwardly move forward in the sort of NCD space and then think about this bigger picture. But at the end of the day, all we're asking governments to do is act in the public interest, you know, and that is what they need to do, act in the interest of their public, of human and planetary well-being, not in the corporate interest. And to simplify messages like that and start to get them across, I think is really key. And we can also, something that's really helped in tobacco, which is a simple thing. So we have this website, tobaccotactics.org, because the industry is always hiding its misinformation, its front groups and so on. It's just exposing all of that. And we can also then expand that out with funding to other industries. And that has just also helped. You know, denormalization is key, and there's very good evidence for denormalizing industry. So there are big steps and little steps. And let me just say that to me, the ultimate solution is probably going to be moving our economic focus away from a single focus on GDP to a far more progressive economic approach like well-being. That is happening in places. There is genuine interest in that. But in our little health fields, we don't see that. So we also need to just see those bigger pictures. There is, you know, I go to other meetings, there are far more radical conversations going on. So there is hope.
Thank you, Anna, for that. Norah, I'll come to you.
I don't want to take up more time by repeating. So absolutely everything that Anna said, and maybe to repeat something that Anna said in a previous conference, I don't feel despair at all. I feel angry. I feel completely energized. I feel so focused. And like in the 5 or so years that I have been in this field, I have seen nothing but incredible ability of government actors and of charities and of NGOs here to understand this really, really quickly and say, how can we start the conversation? So I think, can we take the stick away from us and say, oh God, this is another thing we're not doing well. And here's Anna and Norah and Peter saying, oh God, now look at you's not doing this well. And instead, allow ourselves the space and time to say, oh my goodness, if you think that this is it, if you think that this is the starting point, support your colleagues who are starting at this starting point. And we don't have all the answers, and it might be another 10 years and people in those 10 years doing different actions within the starting point. But our job right now is to ground this conversation and to support each other in having the conversation. That is far better than kind of giving us yet another stick to beat ourselves in the back with. Yeah, we are not late to the table. We're just at the wrong starting point. And this country, in the 5 years that I've experienced it, I'm just like, we have this. So yeah.
Great. Thank you, Norah. And I'll come to Peter, Diarmuid and Orna just before we close. So Peter, to you next.
Yeah, so I'll keep it. So fact-checking works. We have studies that show that when you present people with accurate information, you correct their factual understanding. Number 2 is narratives work. So if I just say the post office scandal, it wasn't, it was a drama. It was a narrative that told people evidence that was all the evidence was out there. The politicians knew what had happened, but a drama, a narrative changed the dynamic. One of the things I've started doing in the last 6 months is I've started working with a theatre company called Sage and Jester, who are trying to use drama to get to people who understand this, to build public pressure around tackling harmful misinformation. And so the fact-checking for factual false understandings can affect policy and direct harms. So support Orna's work, support the work of the Journal in Ireland, support, so that they are very small, underfunded organizations. That needs to be, it works, narratives work. So yes, good reasons for optimism, reasons to be cheerful, as somebody wants to.
Thank you, Peter. And Diarmuid, we'll come to you next.
Thanks. For me, this is just great to see that things are changing. I was at a brilliant meeting last week around local government and health, and just the joined upness of place, environment, climate, health, equity. People get this. I think, as Anna said, public opinion is on the side of this. So there's opportunity for change, but we need to frame our own language appropriately as well and move away from all this personal responsibility. So there's big opportunities.
Okay, thanks. Thank you. And finally, Orna.
Gosh, a hard axe to follow. I think for me, it's about not infantilizing people. People have an appetite for good information, as Peter's just mentioned. We know that. We know when our stuff is shared. We know the reach we have. People want to understand the world around them in an interconnected way. So not just about, the efficacy of vaccines or health in terms of food or whatever. All this stuff is interconnected, and we see that in our work. So I think not infantilizing the general population, but supporting them, in the way that we can, I suppose, connect information in a way that's meaningful to them and make it accessible.
Thank you very much. Thank you to all of you for your input, your time, and especially your expertise bringing it. I think we've had a lot of people on the call. We've had lots of questions. We haven't got to all of them, but I think we've covered a lot of things. We will circulate resources related to each of your work after this call. So thank you very much indeed. I'm going to hand back to my colleague, Roger.